I find I have an issue where some stuff does. They started to finish interpreting.
Okay, welcome everybody. I think I know a majority of the people in the room here. My name is Angela Schmidt, and I'm the director of the Master of Psychospiritual Studies here at Knox College. Great to see everybody. And we have a few guests that will be joining us. We have Ajit Varghese, who is the president of the Canadian Association for Spiritual Care, who will be joining us. And then we have some CPE students as well. So here's the agenda for the next 45 minutes or so. Ajit is going to come and talk to us about who is CASC as an organization. Then we're going to talk about what is CPE. And then we're going to hear from 3 students about their experience of CPE. And then we're going to leave at least another 10 minutes for you to be able to ask questions. Okay, so we're thinking that'll take us about 45 minutes. And then pizza will arrive and we'll feed you. And then we'll go right in at 12 o'clock to the meet. Yes, welcome. To the meet the supervisor part of this, where we will have 8 CPE, so clinical psychospiritual education supervisors. They'll all have 4 to 5 minutes each, where they'll talk about themselves, their programs, some highlights, a little bit about their own supervision style. And the wonderful part of this is that sometimes you never thought of applying to a particular location, but you feel a connection with that supervisor. And so this is an opportunity for you to kind of get that pre-idea of who are these people and where might I like to apply. Knox tells our students to apply to at least 3 locations and that you'll apply through the cpe-toronto.ca website. You all have that on your learning modules at both Emmanuel and Knox, but again, the cpe-toronto.ca website. I'm buying a couple minutes because we have a few more people arriving and I want them to be able to hear Ajit. Thank you, Celine, for getting everybody settled. So just while we're waiting another moment, I'll give you a few tips. One is, when you're applying, it will say on the application form, what is your priority? And it's an open fact that everybody puts where they're applying to in that line, because that center is your priority at that moment. When you go to an interview, you are bringing your openness, your vulnerability, your experience, but also your curiosity about the site, about what this has to offer. They want to get to know you in the interview, and it's also for a chance for you to get to know them. Dress like a professional coming into the interview. Treat it like you're interviewing for a job. And when you are applying through that cpe-toronto.ca website, there's all the options of different places where you can apply to. You're applying directly to that site supervisor. So if you were applying to Scarborough Health to work with Ajit, you would be sending your application directly to him. The application deadline for a summer CPE, that application deadline is the beginning of January 4th. So it means that this vetting thinking time right now is really important. Now, Knox has, I think we have everybody in the room, so I've been able to delay long enough. I am going to be checking in a moment to bring other people in. I'm going to do that quickly right now. Okay, so welcome everybody and welcome to Ajit, and I'm going to give you the microphone to talk about what is CASC.
Thank you. Good morning, everyone.
Good morning.
My name is Ajit Varghese, and for those of you who came late, I'm here as in the capacity of the current president of the Canadian Association for Spiritual Care. When I started as president, a lot of people told me condolences. instead of congratulations. I didn't understand why they said condolences, but 1 year being in the role, I understand why it was a condolences, not a congratulation. It's not an easy job, but I'm happy to talk about. Am I allowed to sit?
Yes,
Is
please.
there any other CPE supervisors online today? Or no? Just a minute. I'm just seeing. I don't.
Peggy Moore?
Peggy is here. Peggy Moore is another CPE supervisor from the University Health Network. So instead of being in addition to being the Canadian president of the Canadian Association for Spiritual Care, I also manage the Spiritual and Religious Care Department at Scarborough Health Network. And I'm a teaching supervisor certified in psycho-spiritual therapy education and also clinical psycho-spiritual education. So CASC offers two streams of education and certification. So I'm certified in both as a practitioner and as a teaching supervisor. And I've been teaching CPE for the last, I don't know, if I tell you how many years, you might guess my age, so I'm not going to tell you. So I've been practicing psychotherapy for the last 25 years. So I started very, very young, So I would like to talk to you what CASC is about. Probably you may have a number of stories from your colleagues about what CASC is, and I'm sure most of those stories are not good stories about CASC. Canadian Association for Spiritual Care. It's a lot of work. They make you work. It's a lot of hard work to get certified in the field and all that. That's true. And so we, as a board, we are looking into changing how we can make it more user-friendly in terms of students coming into the program, MPS programs like MPS. How can we look into creating more opportunities for students to get certified by the time you get completed your MPS program? So which means the structure of the education is changing. Those announcements will be coming probably fairly soon in the new year. But until then, I'll keep quiet. But there are a lot of positive changes happening within CASC, which is making more user-friendly, student-friendly organization. So Canadian Association for Spiritual Care, there's a French name for it. I'm not saying that this morning because I don't speak French, and I don't want to embarrass you by saying French this morning. But Canadian Association for Spiritual Care, affectionately we call it CASC, CASC ACS, is the only national organization which educates, certifies, and monitors the professional practice of certified psycho-spiritual therapist and certified
Spiritual care practitioner.
Spiritual care practitioner. Sorry, there's a lot of psycho in there. I get all confused all the time. So that's the two streams of education that CASC offers, and it's offered in three ways. One is an extended way, which means September to March or September to April, 2 days a week, 1 day a week. And then there is an intensive way, which is mostly in the summer that Angela was talking about, that you are there in a facility, in a hospital or a long-term care facility for 12 weeks, 11 and a half to 12 weeks. You are there every day. And then there is course-based. For example, Knox has a program which is course-based. So there are three ways you can get this unit. They are called Supervised Psycho-Spiritual Education, SPE. That's a larger umbrella. So within SPE, there are two streams of education. One prepares you to work within hospitals, long-term care facilities, and other healthcare facilities, which is CPE, Clinical Psycho-Spiritual Education. The other one prepares you to work mostly with one-on-one client setting, counseling settings, which is Psycho-Spiritual Therapy Education, PTE. So those are the two streams. So CASC, as I said, is a national organization. We live in Ontario. So Ontario, we have another reality called College of Registered Psychotherapists of Ontario. So all of us are considering, I'm a supervisor in CRPO, registered member of CRPO for a number of years. So CASC is a national organization. So the benefit of getting trained and certified in the national organization is that, let's say after a few years, you are moving to another province, your certification within CASC will be still valid in that province, whereas CRPO is an Ontario province-based college. And also, if you're moving to states, our certification is valid in states as well. And we are also negotiating with, UK and Ireland and other countries to see how we can work together and our certification can be reciprocated in those countries as well. So there are a lot of movements happening within CASC. So this is the right time. If you are not a member in CASC, anybody can join. If you have an undergrad degree and want to pursue a degree in psychospiritual area, you can join CASC even if you are not a member, even if you are not joining a CPE unit, you can still join CASC. Call the national office, pay $90 as a student. It's just less than $100. And you can also buy liability insurance through CASC if you are a CASC member. Hello, welcome, good morning. So those are the benefits. And then, so liability insurance, and then there are student bursaries and encouragement for research and professional practice. So you're getting a lot more accountability when you're part of a professional organization, which is a national organization. Again, as I said, if you're just beginning your career, and if you want to move and to other parts of Canada, this is a best organization that you can consider. So CASC has 10 regions across Canada. It's divided at 10 regions, and that's how we function. So we are in the Ontario Central and Northwest region, and some of you may be coming from the other areas of Ontario. So we have three major regions in Ontario, most members of CASC from Ontario regions, actually. So again, excuse me, very multicultural, multi-faith organization, and our certified practitioners, our trainees work in various settings, hospitals, long-term care facilities, military, and universities. Did I miss anything, Angela?
Sorry?
Did I miss anything? Hospital, military, prison. So there are a lot of options in order to, when you are a member in CASC, there are a lot of options for you. And we are also negotiating with other professional organizations how our certifications can be credentialed there as well. So that's a little bit about CASC, very briefly about CASC. I don't want to talk about the political structure and the governance structure of CASC, so that's a lot more for you. In terms of education, if you have any questions, I'm happy to answer. Yes.
For example, students that come from Knox College or Emmanuel College were eligible to maybe pursue CASC registration. What other program backgrounds could you come from?
So are you asking, other than the MPS program at Emmanuel and Knox, what are the other programs that you can be eligible? So in terms of other programs, any programs which are under the conjoined degree programs within TSC, am I correct?
I think, are you asking who's eligible to come into a CPE? Yep.
Oh.
So you might have students from Tyndale College, from Martin Luther, from McMaster. So you might have more than TSC. Certainly, Regis students, Trinity students are welcome. So you'll have a mixture. It won't just be Knox and Emmanuel students in your CPE. Is that answering?
Also, does it have to be like a therapy background, or can it be like a theological background, or any kind of? Does it have to be spiritual background?
Usually we encourage that, because a lot of the work in CPE and PT is spiritually integrated work. So it will be good to have some of this language when you are coming into the program, because it will be easy for you. And not everybody who comes to the program are from the MPS program. We also have a lot of MDiv students, Masters of Divinity students, and MTS students, and some theology licentiate students. So we have a number of students coming into the program. So this is very open for everyone. But the benefit of doing a CPE within an MPS program is you get your hours supervised. And in CPE, when you do that, if you're in a private therapy setting, it takes a lot of time to build up your client hours. But if you're in a CPE program, what happens is it naturally gives you a lot of hours, actually, based on how you work. Not naturally give you, but based on how you work, what's your work ethic, you can accumulate a lot of direct client care, DCC hours towards CRPO certification, and also hours towards CASC certification. Thank you.
What I'm going to do is invite Daniel and Sarah to come forward and have a seat on the chairs, and they're going to talk about their CPE experience, and then we'll take more questions. So do you two want to just talk about your experience or do you want me to prompt you?
Do a bit of sharing first and then
Sure.
you can
Okay.
ask questions.
That's great. Thank you, Dan.
Yeah, so I was privileged enough to be at Sinai Health with Brian Walsh, and it was not my main goal initially when I started the program, but it was something that I thought was a good opportunity and had a really good experience. Yeah, it was very challenging. It was a summer one, so it was quite challenging, quite tiring, but really I learned more in those 3 months than I learned in the first 8 months of my education. So it was a very fulfilling experience, very exhausting. But definitely probably the best decision I made for my program wise, and something I highly recommend everyone at least consider.
Hello, I have two experiences in CASC units. So my first was a PTE unit, and perhaps I can chat with you about that on another occasion. But today we're really focusing on CPE. So currently I am in a CPE extended unit at Niagara Health. My supervisor is Trish Heidebrecht Archibald. And so I knew that for myself and my family that doing a summer intensive was not going to work for me. And so I chose to do an extended unit. So that's just something that I would say keep in mind, because CPE is very intense, that you consider how it will fit in with the rest of your life, because it will take over for if you're in an intensive, it will be a full experience. You have to put all of your time into it. So currently right now, I'm doing my extended unit. So I'm in St. Catharines at the hospital 2 days a week. Thursday is my clinical day. Friday is my learning day. And I also put in some clinical hours on Fridays. And then I am taking 2 courses at Knox. Well, one at Knox and one at another college. And my life is very full. So if you're doing extended, I would take it all in the big picture, what you're planning on doing.
And just before you go forward, I'd like to introduce Marika, who is on screen. Marika, if you want to unmute and introduce yourself.
Thank you for the opportunity. I am Marika, and I'm currently at Scarborough Health Network. I have completed all 4 units, and I've done all 3 at Scarborough Health Network with Ajit. So I'm very blessed to have him as my supervisor, and yeah, it was wonderful, and it is still a wonderful experience under his supervision, working in a very fast-paced working environment, working with everything, as we say, from the birth until death. So yeah, it's mental health and it's pediatrics. So it is a mix of everything. So I'm very grateful to be part of this team and to be part of Scarborough Health Network.
Could you 3 name some of the strengths or from your own experience or just of your perspective of the program, of the experience of CPE?
Sure. I would start with the way that I view CPE is there's 2 parts. There's your DCC time when you're with the patients, you're with the clients, and then there's your reflection time. And so you kind of have to make space in yourself for both experiences. So if you're thinking you're going in just to learn how to, or just to gain experience with clients, that's not the full picture of what CPE is. There's a lot of reflection time. There's a lot of group work together. Some places call it IPR, interpersonal relations. Others call it SEUS time, safe and effective use of self. And in those moments, you have a huge opportunity for personal reflection. This is not this isn't group therapy, but it is an opportunity to really dig in. So I would say keep that in mind. It's more than just meeting with patients.
Yeah, and I'd say one of the strengths specifically of doing CPE is specifically that team that you're working with in a hospital is very different when you're doing private practice. Even though you are part of a unit, it is very much one-on-one, but within a hospital, you're working with social workers, physio, doctors, nurses. There's a lot of different people involved that you can kind of reach out to, depend on. And I think as well, one specific strength I feel this the summer units have, the experience of extendeds may be different, is that the intensity of it actually can really push you to, do the work that needs to be done. There's really, you really feel it fully. Like Sarah said, you don't have, no, it's not for everyone, but I feel like having that, constant every single day, is going to be something you're going to learn, something you're going to do. And it really pushes you in how you can learn what you can learn. And I think the way CPE is formatted with those class days where you have that support in place as well, not just from the hospital team, but also from your supervisor, from your classmates, it can be a lot more supportive than maybe a general practicum in a different career might be, where you're kind of expected to just know what to do. You're very much guided, you're helped, you're assisted, and supported throughout the whole process. I would say that's one of the greatest strengths of CPE.
Marika, could we have you join in?
Yeah, sure. Yeah, I think I can just echo what they shared as well. I think the strength that I experience is like the safe space to be vulnerable in and to be open and to grow together as a group. And I think that is the encouragement that I will give to students who are enrolling in the CPE, is just to be open to change, like in exploring and self-reflecting. It's meeting yourself to be in order to enable to meet patients where they're at. So that was a very big strength for me, my CPE experience, the safe space that my groups and my peers and my supervisor provided throughout my journey in CPE, and learning from spiritual care practitioners who are permanent workers and from the interdisciplinary staff, is to open to engage in the team and the group, and to learn from all the different units. So that is the strength, is like gaining skills in different units. I think that is one of the big strengths that I can take from CPE.
We have a question that's come in. Are you able to break down a day in the life of CPE? Do one of you want to address that?
Maybe Marika has the most experience, so she might want to share.
Sure. CPE, the intensive, it is day to day, as Sarah mentioned. So every day, for me at the unit I worked in, is till 12 o'clock. From 9 till 12, you have didactics and group work, and IPR or SUS, as other people refer to it. And then you go into your units until 5 o'clock. And well, you are allocated certain units, so you will go out to see patients, and once a week you will have an hour of supervision. So yeah, that is like 4 to 5 hours intense seeing patients. And as Ajit mentioned earlier, it is a great opportunity to build on DCC and clinical hours. So it is, in a sense, predictable. You never know if you're going to get a code, so you have to respond to a code. But you have your patients that you will go and see and build a relationship that you can actually practice your theories and to apply your theories and to grow and your skills.
And just before you jump in, Sarah, I could really hear the students describing the action reflection model, right? You are reflecting on yourself as a practitioner. You're going out, getting experience with clients, actually with patients and family and staff members in the hospital with whom you're interacting, offering spiritual care, coming back to the group, reflecting on your experience. You may be writing a verbatim about the experience, the word for word, right, reflection, or you might be writing a case study on a particular reflection, presenting that to the group, thinking it through and reflecting. And so with that action, reflection, action model, it's more like action, reflection, transformation, right? Well, after we've reflected, we're transformed and we come back to the patient with a deeper understanding of who we are coming to the patient, but also of what we can offer in terms of spiritual, existential, or theological and religious care. Sarah.
I just want to mention, in my current CPE where I am, a big part of my day is supporting staff. And so if it's not just meeting with patients in the unit, but so for example, I join in the rounds. My first activity of the day is I join rounds and I listen and I look for referrals and make my presence known. And if I have a referral, I'll say, oh yeah, I'm meeting with that person today, just so that they know that I'm active on the floor. And then I receive more referrals that way. And the other activity that I'm involved with each week is the nurses huddle. I've been asked to give just a short 5-minute moment of mindfulness for the nurses. And this has been another great way to encourage relationship and to be referred to more patients. And the other way is at where I am in Niagara, we have a very active Code Lavender program. And so that's basically a trauma response or for staff. So if there are any staff, if, for example, if there's a traumatic death or if a staff member is just having a really hard day and cannot manage on the unit, they can call a Code Lavender. It doesn't go over the PA system, but they can call spiritual care and someone from our office will go and meet with the staff. And so I think that's something just to keep in mind. You'll be meeting with patients, but also actively working with staff has been a huge gift of CPE.
That sounds great. What do you wish that you knew before taking a CPE unit?
I'll go. I think what I wish I knew before, what is supervision? Like nobody prepped me is like, what is supervision? So it took me a while. I just can like say that, echo that as well. So yeah, like what is supervision? What can you get from supervision? I think that is the biggest thing I wish I knew before.
Marika, how did you learn to get the most out of supervision?
I have a good supervisor, but yeah, he pushed me and he encouraged me to bring cases, like challenging cases that I experience with patients, or we set goals. So how to accomplish those goals. So every week we will check in like how I'm tracking on those goals. So it is to be open. I think it's open to grow and to be honest. You're not a failure if you don't know. Just like there's a supervisor for a reason. So you have to grow and you have to be okay to say, I don't know. So that is like, be honest and take your cases to the supervisor and ask questions, ask many questions.
Yeah, that's really good advice. The openness, being ready to grow, being open to grow, and asking questions. Thank you.
Yeah, I'd say it would have been nice to know how hard it was going to be. Emotionally, the summer units can be quite taxing. So I think even knowing my own what self-care works for me would have been nice. But I think also maybe realizing how much growth I was going to have and really having that knowledge, I feel like honestly, what I had heard about CPE units, it kind of was all there. But what I didn't realize, what was just almost like an internal transformation I was able to experience, where obviously there's the skill level. I'd never done therapy before, started really bad, but my supervisor kept, enforcing trust the process, really being supportive. But just the way that you find out so much about yourself in a way that even if you're in therapy, you're not always in this kind of environment that really pushes you and really forces you to be so introspective. I guess the reflection is a very central part of CPE, and being able to have supervisors, classmates that can help you, not just in your professional growth, but also personally, what's going on internally. Probably would have been a lot more gung-ho about doing my CPE unit if I knew that it was going to have the kind of personal spiritual effect that ended up having on me.
I just want to add on to that. Thank you for sharing that, because you will see one of the requirements for the CPE application is your autobiography. which educational program asks you to write your autobiography when you're enrolling in a program. So you can see that your life is very important. So the program, every component, CASC has 4 major competencies, and under those 4 major competencies, there are subsections. So everything is helping you, a student, to do a lot of self-reflection. That's why we start with your autobiography. And based on that, when you go to a CPE interview, the questions are based on what you actually presented. We'll ask you to see how much self-aware are you in terms of what's happening in your life and emotions that's coming up for you. Can you name it? You don't have to name it. In a first basic CPE unit interview, I don't think nobody's expecting you that much to name the interview, your emotions, but that's going to be happening in the CPE education process. You will be able to name your emotions. For example, I had a student, I asked him, how are you feeling? What is happening with you? He wasn't unable to articulate what he was feeling, but he began to say, I feel calamity. He pointed out and said, I felt calamity here. And slowly, by the end of the unit, he was able to articulate, I'm feeling sad. This is how I feel sadness. My sadness is right here. Or this is how I'm feeling stress. My stress is right on the shoulder. So you'll be able to articulate this very clearly. And also in terms of IPR, it's a great opportunity to learn about group therapy as well. All the supervisors in Toronto are fantastic supervisors, and you will see in that list of CPE supervisors in Ontario, regardless of where you go, you will have fantastic CPE experiences. All supervisors are prepared to guide you through those those processes as well. Thank you.
Sarah.
I would just say it would be helpful to have a background in being trauma informed. I think that's really important. If you don't know what that means, take a look. It's important that we go into this space because our patients will be experiencing trauma. We're in a lot of crisis situations, and just having that approach is very helpful.
Not too hot? No, it's getting too cold. Goodness, keep me happy. Okay, I'd like to open this up to you guys for questions. Gary.
Marika said something a little while ago that how much in CPE can you use modalities with clients, because your visitation window is kind of small with people, right? So is it just mostly crisis care, or can you get into some modality work as well?
Can I jump in there first? A year ago, I worked on a research team studying that, of how is it for spiritual care practitioners coming to the bedside of somebody in the hospital, and how do they do spiritually integrated psychotherapy? Or are they really are they doing that very important spiritual and emotional care? And so we found over the course of the research that students are doing spiritually integrated psychotherapy, but that it took the intention of thinking of what they were doing. So it took that reflection portion to think about, what am I doing with this client that is naming, at least for yourself in terms of spiritual assessment, but what form of psychological assessment are you doing, at least internally, and the kind of questions that you're asking? And then noting what kind of spiritual intervention are you bringing, or what psychological intervention, and that as students intentionally reflected on the dualness, on both, they realized over time that they were weaving back and forth between spirituality, spiritual care, and spiritually integrated psychotherapy, such that they weren't able to tease it out anymore. What surprised them was if you had asked them and they hadn't done that reflection piece, they would have said, well, I'm providing good spiritual care. But by forcing them to reflect, they realized, oh, I am using a Rogerian modality in really focusing on my presence, what I'm bringing in terms of unconditional positive regard, warmth, and empathy. That I do, I took that narrative class, and I am actually asking a few questions that come out of narrative therapy or come out of solution-focused therapy. That intentional reflection helped with that integration piece. that in the hospital, although you would have lots of interactions that are 10 to 15 minutes long and that only happen once. Although that's true, there are lots of interactions that you have that are half an hour or that are an hour and that are repeated times that you go back to the same person. So the structure will look different than the therapeutic hour, which is 45 minutes or 50 minutes. It may have more chunks. But what you learn to do is the building rapport with your person, building rapport, doing assessment, if appropriate, bringing in an intervention and working to some closure. You learn to do that in 15-minute chunks. And in therapy, you learn to do it in a 45-minute hour. But I think that CPE is such good training to be a therapist because you learn so much about yourself and you learn how to do that arc of therapy, the arc of the therapy hour, in very short segments. And, honestly, in the beginning, you just learn how to build rapport, right? And as you're mastering that, then you learn how to build rapport and assess. And, so you're gradually over time adding an intervention and then evaluating.
I can just share in my experience in the hospital, there are folks who are sometimes there for a week and they have a lot of time to think and they're reflecting on their life experience and they want to talk to someone about it. And so when you get into the room with one of those patients, you have the opportunity definitely to dive into those modalities. Like I use narrative, spiritually integrated, talking about spiritual resources, spiritual struggles, some solutions focus for sure, but also somatic applications. Yeah, we definitely get into it.
If you're online and you have questions, feel free as well. Otherwise, over here.
I think Marika was going to answer.
Sorry, Marika.
No, it's all good. I was just going to add what Sarah and Angela said. It is like it depends on the unit. It's like you have a lot of time with mental health patients and long-term care or palliative care or transitional care. So there you can actually build report and apply modalities. But as Angela mentioned, it's also an opportunity to develop that brief sessions, that brief interventions, like a quick assessment, quick report. So there's always opportunity to apply something. It is actually a great opportunity to grow in a diversity of modalities and when to apply it.
I think over here and then to Anne.
I wanted to know, during the CPE course, do you have any opportunities to observe like your supervisor or any other practitioners, like especially as a student going in, you have the opportunity to see what that care looks like with patients?
The answer is yes. My answer is I was able to see and work through how to do assessments, discuss that with my class. But Brian at Sinai really encourages everyone to kind of, learn how they look like doing spiritual care. So my experience is probably very different than most. I've definitely heard different, but I did have the opportunity, obviously, to reflect with my supervisor on things that I was doing, what I was feeling. But I do know if I had wanted to, I could have very well asked a preceptor, which are kind of the on the ground help. So other spiritual care workers to kind of bring me along with them if I felt the need to see. And I do know for a lot of units, that's very important part of the process. And it's definitely, you won't feel like you kind of go in with no knowledge. Your supervisor will ensure that you have the tools to get started. And then as you're working, you do end up very quickly finding out what am I struggling with? What do I need to learn more of? And also you just learn to trust the process that, I was, pretty, excuse my language, pretty shitty at the beginning of the unit. And then I was like, wow, why am I not perfect? Obviously. And then processing that also helped me, with my own growth and learning what I needed. So it's definitely not something that you are left on your own. But it really depends on the supervisor, what that looks like. But part of that is also advocating for your own needs. If you don't feel comfortable going in by yourself, even after seeing a couple sessions, everyone's growth is different. So it's also about, advocating for your needs. But I'm sure Sarah's and Marika's experience are slightly different than mine.
And I'll just help us to be attentive to time because I want to get a couple more questions.
Just in my experience, there was some early modeling, like I was taken to my first code blue, for example. Wasn't sent in by myself. And then we also did quite a bit of role playing on day one, like how are you going to open this visit? What are you going to do when you knock on the door? So we did role playing more so than rather just being sent in.
Anything you want to add, Marika?
No, I'm good. I think it's exactly what they are saying.
Okay, that sounds good. Live supervision will be part of some supervisors' practice where you'll go and observe the supervisor doing a visit. You'll come back and unpack that. Then they'll go with you and observe you do a visit. And then you'll come back and unpack it together. And so there's different supervisory practices, but I really appreciate what Daniel's saying. And Sarah, like, ask for what you need. Anne is next, and then Yasmin, I'm going to come to you.
Practical question. Do you get so when you're doing the non-intensive one, like the extended one for a long period of time, are you in like one specific part of the hospital for the entire duration of that CPE? Are you like in a palliative care ward or in a ICU, or is it just like free range throughout the hospital?
I think you would negotiate that with your supervisor, which unit you would be in. So I have a home unit in respirology. And then, but things come up because I'm the only student who's there on my Thursdays. So if there are codes, I'm sent to codes. I've also been in moms and babies, surgery, like various places. So I sort of have my home base and then I'm sent out.
Marika?
Yeah, and at Scarborough it works like you get assigned 2 to 3 units, but I still work weekends and evenings, so then the entire hospital is under your care. So you attend to all the units and all the codes.
Okay, very good. Yasmin, you have a question?
Yeah. Thank you, everyone. Nice to see you, Professor Angela. I didn't see you for a while. My question is like, how long is the extended unit, and can I mix between CPE and PTE, and how many units in total do I need?
I'm going to have Ajit answer the can I mix the CPE and PTE. But the first part, in terms of how long an extended unit is, it goes over the 2 semesters. So it begins in September after the first week of school, and it ends in the last week of classes in April.
Sorry, what was the question again?
But not in the summer.
What is the difference? Or no, can you move from a CPE unit to a PTE unit?
Yes, you can. In the basic units, currently it's set up as basic units and advanced unit in CASC. So that will be changing very soon. So when you are doing your basic unit, you can actually mix. You can mix up PTE and CPE units. But once you are in the advanced, you have to make a decision which stream you would like to go to. But CASC also has alternate certification stream actually. So for example, if you are a practitioner in one stream for a long time, and if you meet the credentials to get certified in the other stream, without going back to education, you can actually get certified as well. So there is that opportunity as well.
Okay. While you're still here, let's take the question in the back.
Yes.
About how you act as support staff. But is there anyone that supports you with your emotional development, or is that more of a personal thing? And then number 2, I know that in the application process, we're hoping someone accepts us, but is there any room for you to figure out what supervisor fits best with your learning, like your growth as well?
Yes, I can answer this question. Yes, obviously part of your emotional care is your own responsibility, but obviously supervisors are there for a reason. You also have a preceptor. Um, in my unit, I experienced the death of a patient in a unit that really probably shouldn't have death. And I mean, I shouldn't say for some reason, it had a very big impact on me. And right away, I was able to reach out to another one of the spiritual care workers, get support, reach out to my supervisor. Also got really good support from my classmates, IPR. I mean, I think one IPR session, me and another classmate of mine as well were just struggling. So it was pretty much us crying the whole session and really finding support, asking what's needed from the team, from the supervisor to help us. So very helpful. As to looking for fit, I think the most important thing to do is to talk to people because I know the supervisors will simply tell you that everywhere is good. And I know that because it's a pretty small, you know, I guess career choice within Toronto. If all of a sudden it was like, oh yes, this unit is actually not great for these type of students, it can have a general detrimental effect on the whole spiritual care. And so what really works best for you as a student is reach out to people who have done it and who have heard, because that's when you'll get the real information. We cannot really, I mean, CASC is definitely not, because again, they're more association, but really if you want, I mean, I've talked to friends before about, you know, what might be a good fit, what strengths, weaknesses I've heard from places in my own experience. So definitely make friends with people who have done CPE units, or just ask around to see if someone can, you know, give you some information. I mean, you can always contact me. Just don't expect super fast responses at the moment. But I mean, people have my phone number, but I'm more than willing to share my phone number to talk with people about CP units, because I think that's one of the most important ways of getting informed and also understanding our own community, getting to know each other as well. Yeah.
Thank you. I also can say when you go to the interviews, ask your questions to the supervisors. It's not a time just for the supervisors to ask you questions. When most, in my experience, and if you come to Scarborough, I ask you, do you have any questions for us? And I'm surprised the amount of questions that students ask at that time. In that process, the students find out maybe I'm not a good choice for them, or I find that they're not going to fit in Scarborough. So definitely there is an opportunity to ask questions to students who have completed the unit. And also when you go to the interviews, you can ask questions to the supervisor as well. And also go to the hospital website and read what the hospital is all about, so that you know. Sometimes you feel you don't want to work in acute care because there's everything. You feel particularly drawn to mental health. So CAMH or SHN is also big in mental health. So you will be applying to those places. So sometimes it's rehab. So you'll be applying to those places as well. Sorry, yes.
If I wanted to do PTE, does the supervisor have to be a CASC member? So like, can I work with like a private like psychotherapy clinic?
No, if you want a CASC approved unit, it has to be a CASC approved supervisor.
How about if I just want CRPO?
That's fine. You can work with a CRPO supervisor. Yeah. Angela just stepped out. Any other questions, anyone?
For the extended unit, what do the timings look like on a day? Like you start at like 9 a.m., you end up, is it flexible? Is it based on shifts?
I think it's dependent on your hospital system. So mine is 8:30 till 4:30. But sometimes I stay a little bit later, I will say, because emergencies tend to happen. Spiritual care emergencies come up at 3:30 and then you're there for a while. So generally, so I'm there 2 days a week. And within my unit, I can complete all of my case notes during that time also, which is a huge gift. But this is something I wanted to share. You will be required to write a lot of reflections, so verbatim reports, reflection reports. Depending on your supervisor, the frequency will be different. So calculate in time for writing as well.
Yeah, that's a good advice, because when you do a summer CPE, we typically don't advise you to do another course, because this can be packed it's mostly you're doing a lot of self-reflection, can be very tiring for your brain, extremely tiring, more than we imagine. It can be very tiring for you. So please, if you're planning to do a summer CPE, give yourself a lot of time. And the encouragement is not to take another intensive course along with that. Yes.
Can I add one piece to that? For students that need OSAP, you actually do have to take a course.
Another course, yes.
So the best, if you don't have to have OSAP, Jita's giving you the best advice. If you do have to have OSAP, then you pick a course that you think you can manage, or to let the professor know upfront that you're doing a CPE, and you may end up needing a little more time to finish your assignments for the course, not for the CPE.
The one behind you, raised hand first. Sorry. Yeah.
Thank you so much for today. I just wanted to ask, is CPE registered, like, are we able to use CPE to register for CRPO, and can we use SPE for CASC?
When you're doing a unit of CPE with a supervisor who has the credentials with CRPO, you will be able to use those hours towards CRPO as well, and CASC, obviously.
SPE, can we use it for CASC? Or?
Yeah, you can use that. Yeah. Your question.
For the summer intensive, what's this, like the general start date and end date? Like how long is?
General start date is on May 4th and end is on July 24th. So some end a couple of days earlier, some end on Friday. And the application deadline for all the hospitals in GTA is January 4th. And then after a week, we'll start the interview process. Yeah.
And if you were going to do a fall winter, so let's say you're not doing a summer intensive, but you're thinking about next fall and winter, that application will be due the end of May.
May 30th, yeah. Yes. That's a question there.
I actually had a follow-up regarding the hours, like when you were mentioning, this is more like for the summer intensive. How much time do you typically spend outside of like the time you're at the hospital and doing some of these sections, or is a lot of that time embedded into like your time during your shifts at the hospital?
Can you repeat the question?
Yeah, I'm just curious, how much time do you spend outside of your shift at the hospital? Like if you're working full time during the intensive, do you spend a lot of time having to do these reflections and write-ups outside of the time at the hospital, or do you get time to do that during your time in the hospital? Like you get dedicated hours for like self-reflection, write-ups.
Danielle, I'm going to jump in because we're almost out of time. So if you're doing a summer intensive, it's 40 hours a week. It's full time, but you're going to have some activities that you're going to, or some writing that you're going to do outside. So it might be an hour in the evening. There might be some nights when it isn't any, and then some nights where it's 2 hours. It'll all depend on the unit, the expectations. Some units, there's a little more embedded in or a little time allocated for you to do your reflection case study within the unit. It really depends on the particular supervisor, how they've structured it. One more question and then we need to stop.
Yeah, so if you're planning on doing a summer intensive and a fall unit, some of the I've already applied before. Some of the competencies that you might want to do, that you have to indicate in the application for the you're just starting your first one. So like you have to apply again. Like it just seems like you wouldn't be able to really understand that until you actually.
It's a great point that for those of you who are going to plan on doing 2 CPE and one starts in the summer and then you're already immediately applying to the next, the supervisors know that. Like they recognize it. Your paper is going to be very similar to, you won't have much time of growth in order to change things. Many people go on and do a second unit with the same supervisor. And so you'll find that 3 to 4 weeks in, you're already having that conversation with the supervisor, and that really smooths out your process. I would like to thank you. It is 1:12, and we're going to pause. We're going to bring in some other people in a few minutes, but I have a great hope that there's pizza next door. And so what we're going to do is pause, and for everybody online, go take a 5-minute stretch, and we'll start at 5 after 12. So welcome to, I'm gonna.
That's the issue. It's like, you can have really great.
Okay, welcome to everybody who's online. We have lots of students here at Knox College, and they will be grabbing some pizza and coming into the room, but we're gonna ask everybody quieten down so that the people who are online are able to hear. You can go get your pizza and come back in, but could you do it without voices for everybody who's here? Thank you. Okay. Bill Ford, I see you on my screen, and we are going to start with you, and then I'm going to mute us so that you don't have that noise. Would that be all right if I start with you?
Sure, not a problem.
So I'm going to get rid of us here. And just let me know, just reassure me, Bill, that you can't hear us anymore.
No, I can't. Everything's good. Can you hear me though? Okay, perfect. So I'm Bill, and I'm the manager and supervisor of the CPE program at Unity Health, which is St. Michael's Hospital, St. Joseph's Health Center, and Providence Healthcare. So we run the whole gamut from east to west of Toronto. Our sites, St. Mike's is the downtown inner city hospital and a trauma center. St. Joe's in the west end of the city is a community hospital with a wide variety of programs. And then at the Providence site, which is in the east end of the city, that is our long-term care rehabilitation, and the largest of our 3 palliative care units happens to be at the Providence site. Our clinical days, obviously the group, CPE group, as you probably heard this morning from Ajit, there's group days and there are clinical days. We tend to have group days as a full day, clinical days as a full day. So there's no, we're, in group in the morning and we're on the clinical afternoon. So we do it full day just because we are so spread out across the city. And it would take, half a day to get across the city probably, and you would lose so much time. So group days will be a full day, clinical days will be a full day. We assign students to all 3 of our sites. And so we look at, once we interview students, once we have a sense of what students might be looking for, then we try to make a match at each of our sites. But we don't have all of our students at one site. So know that you could be divided or divvied up across the network. For our group day, we tend to meet at the Providence site. And simply because the Providence site has the most space available to us and the nicest space available to us, to be quite honest with you. And so on a group day, you know that you're going to be at Providence. A clinical day, you would be at, your assigned site. There are also some weekend responsibility with our students as well. And that would be in rotation. And so whether students want to do a Saturday and a Sunday combined, or whether they want to split that up, some Saturdays, some Sundays, non-consecutive weekends, or wherever they want to do that, that's fine. It's just that know that there would be some weekend responsibility, and that would be daytime hours and not nighttime hours. Spiritual care at Unity is a 24-hour operation. So we have spiritual care practitioners on site around the clock. We are a large spiritual care team that is well integrated into the fabric of this place at all of our 3 sites. And so I think if you were to come to Unity, if you're interested in coming to Unity, you would certainly be welcomed and part of the fabric. It's a teaching center. We have students of all disciplines And so having students around is not something new or something that, staff around here are unfamiliar with. The other piece about coming to Unity is that students are always placed on units where there is already a spiritual care practitioner working. And so we use a preceptor model. And so that spiritual care practitioner serves as your preceptor during the duration of the unit. I'm the supervisor, but you also have a preceptor who's your sort of go-to person in the midst of a clinical day, seeing that I'm all over the place as well across all 3 sites. So that's a little bit about Unity. I'm not sure if there was anything more specific you were wanting to ask, but I noticed there's a hand up. So, and if you have more specific, want something more specific, please let me know. Yeah.
Oh, sorry, Bill. Adele, can you put your question in the chat? We have 8 supervisors who are going to present, and then we're going to have questions at the end. But Bill will be able to actually answer you in the chat if it's specific to his site. Thank you. And thank you, Bill. That's much, much appreciated. I realize that we still have a large group who's outside of the room grabbing their pizza coming in, and I don't want them to be disruptive to the timing that that people have allocated. Danielle, I can see you up on the screen. Would you like to go next?
Sure. Thank you, Angela. So my name is Danielle. I'm one of 2 supervisors at St. Joe's Health System in Hamilton. We offer lots of units. Primarily, we offer a year residency program. So this is 3 intensive units over the span of a year. We only accept applications for people that have already taken 1 basic unit. So the idea is that you can finish all your CASC training within a year. There is a stipend attached to that as well. So you do get paid a little bit. There is on-call responsibility. Bill talked about that a little bit as well. So that would be 24 hours on call. You do about 4 shifts a month. So the responsibility would be between the residents. You pick shifts, you carry the pager, and you respond as needed. Our education is intense, so it is 8:30 in the morning till 4:30 in the evening, Monday through Friday. Because it's a year long, we tend to split our days. We do half clinical and half education, providing opportunities to connect with supervisors throughout the day and your peer group. We have multiple sites. So being based in Hamilton at St. Joe's, the Charlton site, we're an acute care site. So we have ICU, we have medical, we have nephro, surgical, lots of different clinical areas you can get experience in. We also have the West 5th, which is a mental health site that also has forensics units as well. So that also provides a unique opportunity for students to embed themselves into the mental health sites, to try out groups, and do things like that. And then we also do have a long-term care facility and a palliative care facility that we have been placing students at as well. So there are lots of opportunities to get different clinical experiences. So along with the residency program, we are offering intensive standalone units parallel to those. So if you are interested, we are offering a summer intensive unit, a fall intensive unit, and a winter intensive unit. That's my...
Thank you, Danielle. Much, much appreciated. You can put a question for Danielle in the chat, or there'll be time for questions at the end, but much appreciated. Peggy is from UHN, and Peggy, I'm going to put you up next, but Danielle, thank you. And I'm just going to spotlight you, Peggy.
Thank you. Thank you, Angela, and welcome everyone. My name is Peggy Moore, and I'm one of the supervisor educators at UHN. And UHN is many hospital sites, including Toronto General, Toronto Western, Princess Margaret Cancer Centre, Toronto Rehab, West Park Healthcare Centre, and the Michener Institute. And actually, CPE has been offered at UHN since 1958, so spiritual care is quite integrated into all of the clinical, or at least most of the clinical units. The students who would be coming to UHN would be placed on clinical units mainly in the downtown core at Toronto General, Toronto Western, Princess Margaret, or Toronto Rehab. And would be able to see patients during their clinical time and then reflect on using all the variety of educational tools later. what is unique about UHN is that we use a co-teaching model where two supervisor educators alternate teaching weeks, and this allows the students to see and experience different supervision styles. My colleague Linda Kushnick and I teach together right now in an extended unit. Linda has been a spiritual care practitioner for over 25 years and an educator for 17 years, and she has professional training in psychodynamics and trauma. I myself, my specialty area is if over 20 years of spiritual care practitioner, his end of life, hospice palliative care, both in the community and hospital, and trauma informed grief and mental health. I'd say my style is challenging, quiet, organic, and empowering. A strong J on the Myers-Briggs. So what is also unique at UHN is that students do one evening on-call per week from 4:30 till 11. And in this way, students become staff during the unit get paid for those on-call experiences to mitigate the cost of the education. And of course, during the evening on-call, they'll get many opportunities to work on a variety of clinical units across the whole system. We also have developed a residency program where selected students can be insured to have 3 spots starting anytime along the way. We offer an intensive unit from May to July and an extended unit from September to March each year. I think that's all. Oh, also historically, many students become UHN staff after their clinical training is finished. So for further information about UHN, I'm going to put a link in the chat just about the spiritual care, program at UHN. Okay.
Thank you, Peggy. As I remove Peggy's spotlight, I'm going to highlight Bill because some people didn't get a chance to at least see Bill. There, I've got you. Bill presented from Unity Health. Sorry, Bill, we're catching you with no notice. There's Bill, and I'm going to highlight also, there you are, Danielle. Danielle is from St. Joseph's Hamilton, and so both had an opportunity to present. This is recorded. It will be sent out to all MPS students. So if you'd like to go back and hear them, please do. All right, now I'm going to remove both of you. And Brian, I wonder if we could bring you up next. Let me highlight you. There we go.
Great. Thank you, Angela. My name is Brian Walsh. I'm the Supervisor, Educator, and Practice Resource for Sinai Health Systems. Sinai Health Systems is a teaching hospital that consists of 2 main sites, the Hennick Bridgepoint Hospital at Girard and Broadview, and the Mount Sinai Hospital at Girard and University, so right on Hospital Row. These different clinical settings can appeal to different interests. Hennick Bridgepoint has complex physical and mental rehabilitation, so complex care related to stroke, dementia, diabetes, and other complications, as well as some physical rehab. So those stays are a little longer. It gives you an opportunity to have a different kind of conversation that has a longer arc to it. And at Mount Sinai, we have acute care, which includes ICU, a lot of oncology, a lot of general internal medicine, an emerge department, a psych department. But the biggest thing for Sinai is that there's several floors dedicated to complex pregnancies. So often that means women who are working really hard to keep a child that might be at risk, or it might be the termination of pregnancies at any stage of their time for a variety of physical and social reasons. So it can be quite complex. All of our floors can be quite complex, and so there's a lot of different feelings that you'll be exposed to and need to learn to navigate: the anger, the grief, the fear. And so that's intense work, but it's also really challenging work. We work with students to ensure a safe and effective learning environment in the midst of what is very complicated. There are 3 teaching supervisors here, Irena, Maureen, and myself, and we also have a wonderful, accessible, and approachable staff. We don't work with a preceptor model except in women and babies. where there's more of that, there's more support required. So we like students who are bold and able to walk into a room and introduce themselves, at least as a starting place. Our treatment of students draws from the same competencies we're hoping that the students will draw on when they're working bedside. So we're focusing on embodying and articulating the competencies. So we focus on that sort of being, knowing, and ethically doing the work of spiritual care. This means addressing both presenting level issues and underlying issues. Presenting level is, of course, the surface stuff that people are going through, and the underlying stuff is all of the emotions, values, biases, their relationship with God, the existential concerns that come up. The formation is steeped in CASC competencies. I was on the last CASC competency board, and finding a way to articulate that in a good way is part of my goal for the students, but also each student will have their individual learning goals. Our clinical days and our group days are usually separate. In the summer, we might have 2 clinical days, 2 classroom days, and 1 day that's split. And the 2 hospitals are about 40 minutes apart. So we might alternate sites. We'll figure out what works best for the students. I'm happy to work out the schedule collaboratively. There's no weekends and there's no on-call. So those opportunities aren't here, but there's a lot of complex things happening during the day. And I would encourage you to talk to your peers about sites that they've been on, and about how they've experienced supervisors, because we're all good at presenting ourselves, and we're all, I mean, I love working with this group of people, but also see if you can do sort of a vibe check on how each one of us are, because we all come with our own unique personalities and ways of looking at things. I think that's about it.
Thank you, Brian. When CPE supervisors are receiving applications and considering the mix of students, they really try to find a balance. So they look for diversity among the faith balance of the group, and male, female, and just approaches to life. And so just so that you're aware that the CPE supervisors are really attentive to try and find the right group mix that will be a good learning environment for everyone. Brian, thank you for presenting. And just before we go forward, Trish, I'll put you up next. Trish Archibald from Niagara Health. But just before we do, the group that is here in the classroom are not able to see the chat. And so I'm just going to move back up down a little bit so that you guys can see what's here. Asking about the acceptance rate at Unity Health, which is downtown here, about 5 to 7 students. There's a link to UHN, but you'll find that again on the cpe-toronto.ca. That's the website you're going to. It'll be in both the learning manual, learning modules for Knox and for Emmanuel students, the link that's there. And Danielle has got information there about the residency, which offers 3 consecutive units and moves you right on to certification. And a UHN, again, downtown here, Toronto, takes normally 4 to 6 students. And I'm just reading the last one. Unity Health, we normally say if you want to know what's happening in spiritual care, and many of the cases we're following, you only have to watch CP24. You know what? I don't live in Toronto. Is that like the local TV station? Thank you, Bill. Okay. In other words, it's a lot, right? You're dealing with all of the major issues that happen in the downtown core. So, Trish, you are up next, and I'm just going to get you spotlighted.
Thank you. Hi, everybody. My name is Trish Archibald, and I am I'm in a 3rd unit PSE here at Niagara Health. I've been working with CSE Warren Litt, and I'm just awaiting my certification interview in the next little bit. Thank you. I'm here today with Bronwyn. She's one of our current, she's a 2nd unit student, and this is her clinical day in with us. So I invited her to sit in and just say I have a chance to see the student face here at Niagara Health. Niagara Health is a system of 5 hospitals in the Greater Niagara area. The principal teaching and clinical site is the St. Catharines Hospital. It's the newest of our hospitals, and in my opinion, it offers the best in clinical experience for our students. It's a 400-bed hospital, and it offers everything from general medicine and surgery, and of course ICU and emergency, but also in and outpatient for oncology and mental health, women and babies, and cardiac, and the whole gamut. So students, when they are here, get a broad range of experience. All of our students are assigned a home unit, but through the day, their clinical day, they respond to codes, so they may go anywhere in the hospital, and they also are assigned urgent referrals. So there's an opportunity to become well-known within a particular unit, but also for a wide array of experience over the time here. We offer an extended unit from September to April each year, and our student group is 4 to 6 at the present moment. Friday group for everybody, so it's 8:30 to 4:30, and then one clinical day for the rest of the week that students will just arrange for what day suits their schedule to come on in. We find that that's the great benefit to the hospital here to receive student care throughout the week. I would want to tell you that one of the benefits of Niagara Health, well, several of the benefits of Niagara Health, is the first being that this is a context where spiritual care is highly valued by the health system. Here at St. Catharines, we have 3 full-time chaplains, spiritual care providers. We're all CRPO folks, and there are 2 other hospitals within the system, and they each have a dedicated spiritual care practitioner there as well. So the student coming would join with an already established group of spiritual care providers who provide a number of our didactics throughout the extended unit, and they get a chance to hear from far more than just the supervisor in that time as well. We have also a dedicated after hours on-call team here at Niagara Health. And so there are no on-call responsibilities for the students, and they're happy about that. So many of our students do come from a distance. One of the appealing things, I think, for Niagara Health is that you're not fighting Toronto traffic. You're going in the other direction, and it's really only a half an hour to 40 minutes from the sort of Hamilton hub, and it makes for a much more pleasant drive coming this way out into wine country. The possibilities of students learning also about significant staff support is highly valued here. We have a Code Lavender program that is a big part of our culture here, and students all get some crisis support training while they are part of the units here as well.
And what is a Code Lavender?
And what is a code? Does everyone know what a Code Lavender is? It is support for
specifically staff. So that's anywhere from a nurse is crying in the break room and needs some additional support, or there was a call or a code that went poorly and we're doing just kind of an emotional debrief for the people involved.
Mm-hmm. Anyway, I think that's all we need to say. Thank you, Bronwyn. Bronwyn's obviously on track to become a supervisor herself some point. Anyway, thanks for inviting us today.
Thank you very much, Trish. Much, much appreciated. There are 2 more supervisors to present. Ajit is here to present on Scarborough Health. So I'll have Ajit come up next. I think that's it for the online at the moment. Yeah.
Thank you.
Angela, can you unmute?
I muted the computer. You go ahead. It's fine now.
Thank you. So I was saying Scarborough Health Network is the third largest urban community hospital in Canada. So we are serving a catchment of Scarborough, Markham, and Durham region with over 6,300 staff, 1,000 physicians, and close to 1,000 volunteers. And we have the Ontario's largest nephrology program and the province's fourth largest maternal newborn program. And we offer North America's largest regional community-based cardiovascular rehab and designated cardiac care and spine center for Scarborough and nearby communities. And we are also the Ontario's second largest community mental health and addiction program. So Ontario's second largest community-based mental health and addiction program with over 10,000 patient referrals annually. And we have received, in recent years, several awards for outstanding care we provide. And Scarborough Hospital has been a teaching hospital for a CPE for the last 36 years. So 36 years, we had students back to back for 2 units. We offer 2 units, a summer intensive and a fall unit, which is the extended unit. So I am the teaching supervisor at Scarborough Health Network, and I also have a provisional teaching supervisor who's just being trained, and she is completing her second basic unit as a provisional supervisor, and hopefully by September this year, she will be certified as a supervisor as well. So Scarborough Health Network, including myself, there are 11 of us as staff members, and all 11 of us are graduates of our own CPE program. So as Peggy said, for UHN, we also hire not strictly, I can't say that according to HR, but we actually do the interview while you are a student there. So we do the interview and you automatically come in to become a staff member. So all of our staff members are product of our own CPE program. And the teaching happens at Scarborough General, which is located at McCowan and Lawrence. And the clinical placement takes place across 3 sites, which is the Scarborough Birchmount site, which is at Birchmount and Finch, and also the Centenary site, which is at Nielsen and Ellesmere. So we are a health network with 3 major hospitals and 8 satellites. Students are placed only at the hospitals, not at the satellites. We provide outpatient care, inpatient care, staff care, Code Lavender, and you name it, we do all of that there as well. So it's a community acute care hospital. So everything from womb to tomb you experience in the hospital. That's what we basically say, everything there. So every unit has mental health concerns. Every unit has various concerns. And so mental health is really embedded in various units within the hospital as well. So that's basically about Scarborough Health Network. And I have been a teaching supervisor for over 16 years with a practice of in psychotherapy and spiritual care for over 25 years. Okay. Thank you very much, everyone. If you have any questions, I'm here. You know where to find me. Thank you. Thanks, Angela.
Thank you, Ajit. Ashana, I see that you've come in, and so I am going to remove this spotlight and find you on my screen here. Shauna, oh, there you are. Thank you. I'm just going to spotlight you.
Okay. All right. Do you want me to say nasty things about CAMH? What a terrible place it is to work? I can do that. Okay, so Center for Addiction and Mental Health is, as the name implies, a place where people only work with people who have a mental health concern. We usually have between 4 to 6 students who come in per unit. These units can, work on anything from addiction to we have a women's inpatient unit, which focuses on trauma a lot. A lot of that is sexualized trauma. We have another inpatient unit that we send students to called CCC6, which is kind of a general psychiatric unit. And then we have other units called bridging, which is sort of like a step down from the emergency department. So people will have a variety of mental health concerns that they could be exposed to. And then we have a lot of work within our mood and anxiety and outpatient addictions programs, which are pretty cool, pretty interesting. If you're interested in learning, having like a real deep dive into various mental health disorders, mood disorders, and particularly addictions, then CAMH would be a good place for you. We do focus a lot on the psychotherapeutic aspect of spiritual care, and people who come here, we practice a lot in working with a 50-minute hour when we're working with patients. So that's a big focus of what we do at CAMH. We don't do as much sort of prayer by the bedside. We do some of that, but it's not a lot of what we do. We don't experience a lot of deaths at the hospital. If you were like at Scarborough, as Ajit just said, you would probably experience a fair amount of deaths. So if that's something that you feel like you need, then CAMH might not be the place for you. We do experience some deaths, but they're very few. We might have like 2 or 3 deaths a year. A lot of our people, when they get sort of sick, they get sent somewhere else. And only in the last couple of years have we been approved to sort of keep patients who are palliative within the hospital. So most of our deaths are patients who are expected to die. And most of those are in either the forensic program or the geriatric program. Yeah, so if you're interested in learning about mood disorders, how to provide trauma-informed care, if you're interested in learning about yourself as a care provider, then CAMH might be the place for you. Of course, you have to deal with a horrible supervisor. That person is really difficult to deal with. So might want to think twice.
Thank you, Sean. Much appreciated. I know for those in the classroom, there's about 30 people here, and those who are online, I know it's a lot. It's a lot of content, but sometimes you just need a little information that twigs you, right? And so you've heard from Bill Ford at Unity, from Trish Archibald at Niagara, from Shauna at CAMH, from Brian at Sinai in Bridgeport. You've heard from Peggy at UHN, and from Danielle, who's over in Hamilton at St. Joseph's, and Trish, just down the road. Trish, you got in there twice. But we have one more, and sorry, you heard from Ajit, right? At Scarborough Health. Who you're not hearing from today is Bavli Cost, who is at Mackenzie Health. He's on parent leave at the moment. And also Duke, who is at Lake Ridge. So our next supervisor, our last one, is Rabbi Haber, who is at North York. And Rabbi Haber, I am going to spotlight you.
Well, thank you very much. It's nice to be here. I apologize for getting here a little bit late. North York General Hospital has a long history of CPE, but over the last couple of years, with the retirement of their previous CPE supervisor and the restructuring of the spiritual care department, had not had CPE in the last couple of years. Up until 2024, I was the director of spiritual care and CPE supervisor at Baycrest Health Sciences, from which I retired. But there was a position open here at North York General. My wife has a couple of years to go before she retires. So I decided to jump back in. So we have had our first CPE unit since I've been a director here, but I do have 18 other CPE units under my belt at Baycrest. And we will be offering a summer unit starting in May, and again a unit in the fall for the academic year. Norfolk General Hospital is an acute care hospital right off of the 401 and Leslie Street in North York. It is one of the top 10 hospitals in Canada, and it's known for its research as well as its patient care. It is an acute care hospital, so we have an emergency department, we have neonatal intensive care and obstetrics, prenatal, postnatal, NICU. We also have oncology unit, general medicine units. We have an ICU as well as a step-down ICU. We have a stroke unit, neurology unit, really a psychiatry unit. So those interested in a well-rounded acute care hospital experience will have the opportunity here at North York General, where spiritual care is deeply appreciated. And we focus both on spiritual care and psychotherapy. So depending on the context of the visit, you may be utilizing more spiritual care tools and interventions, or you could be using more psychotherapeutic tools and interventions, depending on the nature of the patient that you're meeting with. The way I've been generally conducting the CPE is because we get a lot of people who have commitments to family and to other jobs, is that we hold our classroom sessions on one day and then give the student his or her choice as to when he or she would like to come in for their clinical day during the academic year. During the summer, we're here on campus every day, and the day is split in half with students spending half the day in clinical and half the day in classroom, IPR, etc. Sessions. So we have a current class of 6 students, and half the class is Christian, half the class is Muslim. And we work in a multi-faith environment. So we serve everybody regardless of their faith tradition. Of course, if there's a request for faith-specific support, we can arrange that. We do have a group of religious care volunteers who are religious specific focused, who come in and visit folks of their own faith group as well. I mean, that's just basically a broad overview of the program here. If you like working with dedicated professionals who are at the top of their field, leaders in their field, then this is a wonderful place to work. Depending on the unit you're placed, it'll either be fast-paced or more calm. So that really depends on your interests and available placements as to what kind of experience that you have. But all experiences here will be very fulfilling. So just a brief overview about the program at North York General. I'm happy to take any questions too.
Rabbi Hager, I really appreciate your name tag. Can everybody see it? That if you're a patient in the hospital and you're not well, and you have lots of medications flowing through you, and you feel a little bit confused, it's really nice when you can read who it is that's coming to see you. So I'm noticing the big bold letters and how helpful that is. So thank you. What I'm going to do is I'm going to highlight the group. Okay, so I'm going to add each of the supervisors here, and Ajit is going to come into the middle. Sorry, I'm still seeing the ad. Where's my ad?
So while you're looking for that, somebody asked a question about weekend work, and the answer is yes. Well, I mean, the classroom days are held during the work week, but since you have freedom to select your clinical placement day at North York, you could theoretically do a weekend day.
That sounds great. Brian, I keep trying to add you as a spotlight, and the option is not coming up for some reason. I'm gonna try one more time here. There it is. Okay. Did I miss anybody? And Kelly, I do recognize I've added you in. I think that's all our supervisors. Not all have been able to stay. And Ajit, if you come into the middle so that we can see you, and I will add in this as well. Ajit is going to speak to the process about how, sorry, here it is, right behind my back, about how you apply.
Hello, everyone. Happy to see my colleagues online there. So on behalf of all the colleagues, I want to say the application process is fairly straightforward. You go to cpe-toronto.ca. That's cpe-toronto.ca, except for Niagara. I think, Trish, you're not on that site yet, so maybe you might want to consider that. So in that website, you will see all the teaching centers and the programs called courses, teaching centers, and teaching supervisors listed. So as we said earlier, please go through each teaching center that you would like to apply, read about the teaching center, read about the teaching supervisor. And then if you find that you would like to work with Shauna at CAMH or Brian, get their email address from the website, then download the application. The basic application form has 3 required essays, and it also requires your resume. So download it today, go through the application form. It's very straightforward, and prepare the essays. Once you have it together, attach all of them as one file. It will be helpful for supervisors to have it as one file, your application first, because it's a Word document, and then your essays and your resume, everything in one file, and send it to the teaching supervisor to whom you would like to apply. Okay, so somebody asked me, is there a general portal where we can apply, download and apply? No, we don't have that process. So unfortunately, you have to individually apply to each places you would like to apply. And the encouragement is that apply as many places you want, and you will get an interview opportunity. You may or may not, because depending on the summer volumes of application, some teaching centers interview all the students who applied. Some don't, especially at Scarborough. We don't interview everybody who applied. We actually go through an application screening process and select a few to interview, because it's highly competitive across GTA and in Niagara and in Hamilton for the summer program. So you might want to consider getting your application early. The deadline of application is January 4th. And then there is a week for the supervisors to sort out everything, and then we start the interview. And all the supervisors will be offering you positions on the same day. So same day you will be hearing from everyone, whether it's a yes, and then the supervisors will tell you how many hours or days you have to respond back to them. And my encouragement is, if you decide after the interview and application process, if you decide you really want to go to CAMH, and you made that decision, you got an admission from Shauna, and then what you can do is you can immediately decline the other offers, so you don't have to keep them waiting. So sometimes I see that students sit on it, because I have 2 days, let me sit on it. Please don't do that, because other supervisors are trying to offer it to the next person in line. So we want to make sure that you're doing justice to others. If you make sure that this is the place I want to go, and I'm sure I got it there, and then immediately apply and decline the other positions. So any questions regarding the application, please let me know. I'll be here for another couple of minutes after the meeting. I'm happy to answer any questions. And Trish, I don't know how your application process is, so you might want to say that. But Hamilton and London are also on the CPE website, the cpe-toronto.ca website, and it's up to date. Everybody's program is up to date. It's programs in GTA. It's starting on May 4th and ending on July 24th. And the application deadline is January 4th. Thank you.
And if I could remind the students, you write your autobiography paper in the Foundations of Counseling course, right? So you get a draft of what you're going to put in for a CPE application, and then you write about your spiritual care practice in your human growth course. So when we say that there's 3 papers, 2 of them are embedded into your courses, and the third one is what are your goals, right? And so just you know that the application is not as daunting as it may feel, because we really prepare you well to do it.
And you might want to add, make your resume look good, and add all your experiences that you have related to spiritual care, other religious work, community services, so that the supervisors who's reviewing your application gets a very comprehensive understanding of who's applying. So that will be helpful for you. Please don't think this experience is not relevant to spiritual care. So I would encourage you to add everything there so that the supervisors can decide what's best for their sites.
On the screen is Kelly Collins. Kelly will be taking over for me for the winter, doing the placements while I'm on sabbatical. So Kelly, do you want to just say hello?
Yeah, hi everybody. Just so students are aware, I was a spiritual care provider for 5 years in hospice, then became a CPE supervisor myself in the residency program. In fact, Danielle, when she was on the screen, I was looking at my old office, having some fond memories there. And more recently, I spent 3 years in Kingston as the director of spiritual health, mission, and ethics, and have now gone into private practice. So I've got some good experience and look forward to supporting you all as students and the supervisors with the placements.
Thank you, Kelly. Okay, this has been a whirlwind. We have 6 minutes left. If you have questions, and you may just feel like your brain hurts at this point, but Ajit and I will be here in the room, and you can access the emails of all of the supervisors on that cpe-toronto.ca website. So if you've got specific questions for the supervisors, please feel free to reach out to them. Keep in mind that when we say the deadline is January 4th, you can apply anytime now, right?
We already started receiving applications, so you can apply anytime now. Just wanted to say that 2 of the supervisors who are offering units are not here. So just wanted to mention their name, if that's okay. Duke Oliogu at Lake Ridge is offering a summer unit, and also Bavli Cost at McKinsey Health offering a summer unit. So their information is on the website, and Bavli is on vacation now, so that's why he's not here. So McKinsey Health, one of the state-of-the-art hospital right there. So if you're close to one, that's an option for you. And if you are from further east, there is Duke there in Lake Ridge as well. Did I miss anything else?
No, but all of these supervisors that we've talked about today are registered psychotherapists.
Yes, yes.
Right? So again, just clarifying that all those hours get added. If you are applying to CRPO, there is a unit. Sorry, there's all our phones going off for an emergency. Oh.
Was just testing the system.
And so I just wanted to let you know there is a unit that runs not in the summer, but in the fall in Barrie at Royal Victoria Hospital. It is not offered by a registered psychotherapist, so it would not count in the NPS SCP certificate, but it would not have hours for CRPO, but it would count if you're just doing an MPS degree. So if you're just doing an MPS degree, they're also in Barrie as a unit at Royal Victoria Hospital.
What would you say would be the best course of action about going about finding out if your supervisor is both CRPO certified and CAS? Would it just be asking directly?
Everybody is except for RVH.
Okay.
Okay, so but Anika is asking, how would you go about it? Ask. Always clarify, be assured, but any of the programs that we recommend through Knox and Emmanuel, We only recommend the ones that have an RP. And it doesn't mean the other ones aren't good. It just means that is a requirement for everybody doing the MPS, spiritual care, and psychotherapy certificate. And there are PTE programs. We're not highlighting them today, but Knox offers a PTE, a psychospiritual therapy education program. Emmanuel offers 2 of those under Nazila. And then there, of course, is the PTE in London under Alita Van Dyke. But we highlighted those in a different section. Okay, Jared.
I have 2 questions. One is the CPE Toronto website updated with the dates, because a lot of them have 2020.
It's updated. It's currently updated. It's updated as of last night. Everything is fully updated.
I checked it not long ago and it was okay. The second question I have is, in the application, is there still the section where you rank your choice of?
No, that's been taken out.
Okay, good. Because I was wondering if that affects your prospects somewhere or not, right? Because you're saying apply to as many as possible, but I think they only had 2 spots before.
Yeah, it used to be 3 places you could apply. I think the supervisors decided to take out that part. So now there is only 1 option. So if you have to apply to multiple places, you have to change that part and apply to multiple places. Yeah.
All right, cool. Thank you.
Yes.
Are there any of those placements in Peel, or basically the choice is between Niagara region and Toronto?
So the question is, are there any places between Peel? So is Peel Brampton?
Yep.
Brampton, Mississauga.
Okay, in terms of Brampton, Mississauga, there is not a CPE placement at Trillium nor at William Osler. But you may be able to get a placement under a spiritual care practitioner. It just won't be a CPE placement. And so those are possible through the Knox and Emmanuel CPE groups or individual placement groups. So talk to Nazila if you're an Emmanuel student, and talk to me about it if you are a Knox student.
Yes.
Just wondering if there's a placement at the Homewood at all in Guelph?
There's not a placement at the Homewood. What we're highlighting are those centers that have CPE.
Yeah.
And so there are a whole variety of placements that you can have that are in healthcare, but that are not CPE placements. So then we do something creative with you. You do your placement supervision there, and then we put you into a group for a little bit of that SUS processing, and you do a learning plan. It's not as robust.
I see that.
And so there is a placement in Kitchener with Florence Yuma out of, they changed their name. It used to be Grand River, and it has a new Waterloo Regional Hospital System. Yeah. I think we've got time for one more question. Is there anybody online? And if not, yes, go ahead.
The essays and each of the applications have to be unique.
Sorry, application.
Unique, the essays, write 3 essays for the application.
There same package for everybody who you're applying to, but as Ajit was saying, change the name on where you're applying.
Yeah, of the hospital.
And I'm just checking through online in case there's anything here that needs to be answered, but it looks like everything is there. Okay, it's 1 o'clock. Oh, okay. One more question.
I just wanted to ask, are the interviews typically online or in person?
Depending on the site, some interviews are in person, some are online. It's depending on the site. When you apply, the supervisors will let you know how to show up for the interview. Yes.
All right. I'd like to thank everybody who's online, everybody here. And I'd like to thank the supervisors for giving your time and giving us a picture of supervision at your site. Thank you all. Take care.